Hello, dear friends. Welcome in Homeopathic Canada live sessions. And today is the fifth day of December series, Homeopathic discussion series. And during this sessions, we are discussing about difficult cases, advanced pathologies, and how to treat them. So during this session, we will discuss all the problems we face while treating the diseases. So mostly we are focusing on advanced pathologies. So last time I invite one doctor from India. He is a master of treating cancers. Today I invited one of the greatest homeopath who is master in Boenninghausen Repertory. So he will describe all these cases through Boenninghausen Repertory, and I advise to everyone, if you guys have a Boenninghausen Repertory handy, please bring with you so you can easily find out how we can use Boenninghausen Repertory. So we will he will soon with us. With us, then we will start our today's sessions. So during this conversations, if you guys have any questions, please write it down, and after that we will discuss all your queries. And if you guys have any issues, let me know. And during this process, every day we will invite one of the master of homeopathy, so we can learn from them, and we can use that informations in our daily routine practice. So today we invited one of the best homeopath. He is master in Boenninghausen Repertory, and his name is Dr. Kapil Sharma sir, and he is also my teacher. And I saw many cases of him, and he is really a great person. And soon he will with us, and we will start the session. So bring your BBCR with you, and hope so we will discuss all the information regarding Boenninghausen Repertory. So this is one of the best. This is one of the best session if we want to learn Boenninghausen Repertory. So all these cases belongs to Boenninghausen Repertory, how to use Boenninghausen Repertory, and how we can solve the cases through Boenninghausen Repertory. So is so I would like to welcome sir. So and
Thank you.
so much
Thank you,
for
Dr.
your time giving to us. And we know that you have a very busy schedule, but thank you so much for us giving a time for us.
This is a problem of the clinician
Yeah.
for
Yes, sir.
time.
So the person who don't know him, his name is Kapil Sharma, sir. So he is having vast experience in homeopathy, and he is master in Boenninghausen Repertory. And I suggest everyone to get Boenninghausen Repertory with you guys. So when he explained the cases, so you can search out these particular rubrics so you can learn homeopathy through Boenninghausen Repertory. So we will discuss few cases, especially the difficult cases, and how to deal with it and how to learn Boenninghausen Repertory in easy way. So I will not wasting sir time because he has a very limited time. So over to you, sir.
Thank you, Dr. Dev. We are here to learn Bogan Boenninghausen repertory. If you are using this repertory, one thing you must be remember that is aphorism number 153. Because in that aphorism, Dr. Hahnemann clearly emphasized the characteristics prescriptions. You always search out characteristics, peculiar symptoms, and prescribe. In a homeopathy, so many learned stalwarts describe, take the whole history of the patient. It means, it doesn't mean you add all the symptoms in repertorization. If you are adding all the whole case symptoms, make rubrics and add in the repertorization, it like a garbage in, garbage out. Whether you are prescribing over the materia medica, according to the materia medica, according to the repertorization, you must be always emphasize over the characteristic peculiar symptoms. If it means Dr. Hahnemann stressed the you took the whole history of the patient and search out the peculiar, strange, and characteristic symptoms, and that is the you can prescribe easily, and then you study that aphorism 153 in brackets. Dr. Hahnemann clearly mentioned the names Dr. Zahar and Dr. Boenninghausen, because Boenninghausen made a repertory of the characteristics, not a proving. If you are uh, taking the register of the proving, like Allen, there is so many symptoms. One thing, what is the difference symptoms and rubrics? Rubrics is a language of repertory. Symptoms are language of a patient in the materia medica. So we should learn the difference between symptoms and rubrics. Rubrics means symptoms laid down in the repertory in a particular manner. So that is called rubrics. So characteristics. If you are taking the whole story of the patient case, taking all the symptoms, and you make the rubrics for the whole cases and putting down the repertorization. So you will find 5 remedy first in repertorization. First, number 1, sulfur. Number 2, thuja. Number 3, maxol. Then phosphorus. Always, in every case, if you are taking that you repertorize the case, the four remedies always in the first, second, third, and then start other medicines. So it means, can you give the remedy, prescribe the medicine to every case of phosphorus like sulfur or maxon? No, because in these 4 remedies, there are so vast symptoms, In a can, there is in 20 pages or only of phosphorus, and 18 pages of the thuja. How can we prescribe in every case in these four remedy? It is not homeopathy. So if you are taking the whole case, you search out the always characteristic, strange, peculiar symptoms. In India, Kolkata prescribing is very famous. And it is in whole world. You will find they follow the Allen's keynote. If you are searching the homeopathy literature scientifically, Hahnemann, then Boenninghausen, then Herring, then Allen, and then Clark. If we are talking about Materia Medica, so number one, Hahnemann, then Herring, then Allens and Clark. What is the difference in these four? Hahnemann proving, only proving, and less clinical verified the symptoms. Herring proved and clinically verified all the symptoms in clinic. And if you have not a time to study the whole Herring symptoms, Herring's guiding symptoms, so then you can rely over the Clark, because Clark is a notes of Herring symptoms, Herring guiding symptoms, Materia Medica. And then if you are want to crux of Materia Medica of guiding symptom of Herring, then you go to Allen. This is the stages of the Materia Medica. You will find the characteristics and clinical use. If you are to study the Herring guiding symptom, in every paragraph, he give symptoms, then dot, double dot, and the disease name. Means these symptoms use in this disease named during the prescribing on the disease name prescription. So you can verify there. So if we are coming to BBCR, whole one thing more you must learn. Final court of appeal is Materia Medica. This is a phrase in repertory. Every prescription must be rely on the Materia Medica. If medicine is not matching with Materia Medica, it means something is lack. One thing, BBCR based on mainly Herring guiding symptoms, or you may clarify the medicine from the Clark. Every medicine you will find the, and you go now if we are talking about the new making repertory or use repertory, there is no philosophical background like the big. They mix up all repertory in one place. It means there is huge number of rubrics and medicine, but there is no scientific data behind that. Like you find the rubric, any rubrics, there are so many medicine. Can't give the two medicine. Now there are 20 medicine and 40 medicine. How? Because if anybody give any clue of the rubrics or symptom, they added that rubrics medicine, that rubrics. How can you verify that? in from the Matia Medica. You don't know where it will mention and how this come here. So always use the verified Matia Medica and then the report. Then your result will be very high. So come to the BBCR. BBCR is the characteristics based on the characteristic journal symptoms of the medicine. Like that, I want to share a case. The case was the urethral stricture. The name of that case was the Sanjay. He came to me the problem of the stricture. Uh, he was suffering from the urine problem last 2.5 years, and recurrence retention of urine due to the stricture. He told me first time slightly stricture was there because it was not full stricture. Only slightly urine stream become thin. So urologist surgeon done the dilatation and back to the home. After 6 months, the problem once again occurred. Then he went to the same surgeon, and again he did the dilatation, and again he come through this problem 3 months, 2 months, 1 month, and last time when he came to me, before that 1 year, from the 1 year, he using the some stick to dilate the urethra, and whenever to get the problem, he passing out that stick and that passing out the urine. He asked me, doctor, I am using this stick usually daily. Oh no, otherwise every third day. Otherwise, my urine become retarded in the bladder. Can you treat this? So, yeah. And I prescribed at that time arnica because recurrence dilatation. In my mind, it is a recurrence injury. So dilatation is occurring. So after few days, no relief. Then I changed the medicine. Recurrence of urethral stricture. Medicine is Thuja. So I prescribe on the basis of Mathematica. Thuja. But there was no effect. Then I decided to take the help of repertory. So again, case taking done. His problem was recurrence stricture in urethra. Appetite was normal, thirst was normal, his stool was constipated and hard. And there was no history of injury and not a very remark of the thermal. Where we are living here in India, in this side, UP, here in a summer, temperature goes up to 40. And in winter, temperature come down to single digit, 2, 3. So it is very hard to ask the patient what type you have the thermal, chilly and hot. Most of patient says both are, we are very sensitive to both thermals. Some are we are used to. So thermal are normal, thus was normal. There was only two symptom was there. Recurrence of urinary stricture. Second was stool, hard and constipated. So I consulted the BBC. This happened every time to the every case. What I am told you, four medicine, sulfur, calcarea carb, thuja was there in the first three. So then I asked again, desire for sweet, no, lot of sweat, no. Then medicine after that, medicine was petroleum and magnesium. Petroleum is a very good medicine for urinary stricture, according to Matria Medica. It's a top grade. Here, I decide to confirm from the Matria Medica. So I didn't found the picture, but I read in Fatak Matria Medica, urethral stricture after dilatation in magnesium. You will find Fatak repertory of urinary organ. Second last symptoms is stricture after dilatation. Clearly mentioned in the,
Yeah.
if you read magnesium, the second last symptoms is stricture after dilatation.
Yes, sir.
When I prescribed, he came 25 after 25 days. Yes, after 25 days, and said, Doctor Saab, my constipation has gone. But in the stricture, little slightly changes, which I am this stick using twice or thrice in a week. It is using I am once a week. But my urine stream is weak still now. It's okay. Carry on. After 3 months, his urine stream was normal, constipation was normal, and he is not using the stick. I stopped the medicine and I prescribe only Seclec, continue for 2.5 months. But no use of the stick, and you are very go happy. So, if what is the lesson from this case? Don't use the whole useless symptoms or rubrics. Number one. Number two, what is the characteristic in the patient? Whether it is so many or few. In this case, I use arnica first, then thuja, here, but no effect. And in this BBCR, in between, there was the suggestion of the Hippersulf. But I was not satisfied from the Hippersulf because they were not extreme chilly, so that, and Hippersulf doesn't covering his constipation. So, me, if you are, why Fatak here? Because if you are using the BBCR, BBCR means Boger and Clark. And if you are using the Fatak Materia Medica, this is BBC. BBC means boric, bogar, klar. If you have the disease uh, based prescribing, the boric is the best Metrium medica. One thing more, Dr. Hahnemann emphasized what is curative power in remedy. What is this? Dr. Hahnemann stressed over you must know the pharmacology of every medicine. This is the missing link in the homeopathy fraternity. They don't use this thing. Dr. Bogar, CM Bogar, catch this thing. And he find out what is the pharmacology because Dr. CM Bogar wasn't a doctor. He was pharmacist, B Pharma. In the pharmacy, there is a big lesson of the pharmacology of every drug. So he used that in homeopathy. And it was a very, he was a very master prescriber because he knew what is the pharmacology at a particular remedy and what is the symptoms of the remedy and match and prescribe. So we must know the pharmacology of every medicine, that is curative power of remedy. And what is curative in patient? This must be a similarity. No? Then one more case is a very interesting case. A mason contractor came to me and put down his all the record. There was a stress ECG and echo. In that, there was a chok of an artery. So there was a angina pain. He asked me, Doctor Saab, I want to go under the angioplasty because I have no so much uh, finance and I can't afford the time because I am very hard worker. Then I asked, what is your problem? Well, I have pain in my chest and some respiration problem. When I become a heavy work, what type of work? Only walking. In walking, always in walking. Okay. Then I take the whole case and prescribe first arsenic album. After 1.5 months, there was no change. Again, I consider the whole case. Then BBCR suggests me ammonium carb. This is very good medicine for cardiac asthma, but no relief. I decided to take the whole case one by one point again. So he told me when I walk, then heaviness in chest and some choking in my throat. Then I asked, how you can perform your duty because you are contractor. He told me, Doctor, when I go in over my work, and I walking over the stair, I have no problem. But when I walk in the ground, in the floor of the any house, then I have the problem. And in whole the case, this strike me. Me again told me. Then he repeats same statement. When I walk over the ground or over the floor, when I check the work, I have problem. When I go up in the house or over the walking over the stair, I have no problem. This was very peculiar, this whole case. Then I found uh, ascending, walking, ascending, aggravation. Sorry, ambulation. But there were so many medicine, and I prescribed again. Then it was the Rustox, but no effect. And then I again consider what will be the main crux I have, but I didn't find the remedy. So I opened the BBCR, that is the condition, last one from the 111 and 2 page, and again I, and every rubrics, read every rubrics, note what will be the possibility. You will surprise. I took the repertory of BPTP, but I checking the rubrics one by one. There were the rubrics walking over label aggravation. And I search out this thing in BBCR. There were also same rubrics walking on the label ground. Medicine was Ranco's bulbosis. I present this case in a webinar of Dr. Alam Khan and Dr. Pankaj Agarwal. Also present a case, another case, his own, of the pain in left scapula from this rubrics. And because he, when is this symptoms or problem from the this rubrics? So when I prescribe Ranco's bulbosis, and very interesting thing, in the whole repertory and other Matia Medica, there was no role of Ranco's bulbosis in cardiac effect, but he improved tremendously from the Ranco's bulbosis. After 3 months, there was no problem in the walking over the ground at level, and then I advised to him, don't think you cure. Go again your investigation, then decide. So in that case, he came to me so many after many months, 6 or 7 months, and asked, "Did you go under the any investigation?" Then he told me, "No, no, doctor, I have no problem, so I didn't go that under the investigation. But I am okay." This is the peculiarity in any case. One more case. It is the case of a very senior advocate. This is he is the very senior advocate of the criminal cases for the criminal cases and very renowned. When he came to my clinic with his wife, he said to me, Doctor, I have a problem of nausea, indigestion, some acidity. It's okay. Then his wife said to me, Doctor, we are here not this problem. We are coming to, we want to quit this alcohol. Okay. What is the problem? Doctor, from last 3 years, he's taking alcohol, and now the position is he is drinking from the waking time, and from this habit his practice is also suffering. His friends and advocates and colleagues also complaining that this guy is drinking very hardly and very profoundly, and he drink from morning to evening. He didn't drink only at the bedtime, in sleeping time. Then that person agree with that statement of wife. And it's okay. How much you are taking daily? And then he replied, 300 to 400 ml per day. But he was so high. Well, yes, sir, I can't live without that alcohol. Have you taken from the beginning? No, 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 no. From the beginning, I took only 1 and 2 pack occasionally in party or any, but didn't take regularly never. It's okay. How you started this thing? Well, suppose it's okay. I'm starting very occasionally, but now I can't live without alcohol. According to Materia Medica, I prescribe syphilis. Syphilis 30 single dose go. After 15 days, doctor, problem was same, all acidity, nausea, and lot of saliva. It's okay. I again ask the problem, nature, all the things. I prescribe Naxlomica. After 1 month, there is no relief, acidity. But my concern about the alcohol, why you are not quitting this alcohol? Again, doctor, I can't live without alcohol. And then at that time, I counseling that person, but no effect. He told me, Doctor, I know each and everything. What is the con and cons of the alcohol? Don't tell me these things. Only if you have the medicine for this quitting the alcohol. Otherwise, I know each and everything. Why are you are wasting your and my time? This is very. Then I ask the question: how to start? Well, I don't know how to start. At the over the this fifth visit, his wife again he came again, and I asked the many so many questions. He told me, Doctor, He's liking only rice. He didn't eat the chapati and all the thing. Only rice. Prefer the rice. More hardly any time he eat the chapati. It's okay. Then I asked to that advocate, "But what is the problem? Oh, no, no, no. So whenever I eat the chapati, I feel nausea. And from the rice, I'm okay. After this, I study again the case and find out the. And again, I call that person after 1 week and I ask, tell me the whole story, how to start the problem. He told me, Doc Saab, this is the happening from the last 3 years. I have the problem of nausea, vomiting, and lot of saliva in my mouth. Every time I feel the very nauseatic feeling. I have gone to the uh, gastrosurgeon and gastroenterologist. No effect they give them any medicine. I feel drowsy. And whenever I left the medicine, same again, nausea, vomiting. When la, uh, 3 years before, some of their friends make a program to uh, some long drive and they share me. And that time I'm feeling some nausea, vomiting, so I denied. And they pursue me to go with him. So I went to that time. So they carry the beer. I drink the beer. That time I didn't feel any nausea. Then it's okay. After few days, same problem. Then I took a beer. So nausea gone. And next day, again, starting the nausea, vomiting. So I took a little amount of alcohol, whiskey, and my nausea gone. And this is happening day by day. I increasing the alcohol quantity, and it's up to 300 to 400 ml. If I took alcohol, I'm feeling better. Otherwise, nausea, vomiting, so many saliva, I'm spitting out. So I prescribed the Lobelia.
Yes.
When I prescribed the Lobelia in Flata, he told me a little effect over the nausea, but same thing is happening. Then strike in mind his wife's statement. He is only eating the rice, not chapati. So this is very interesting case. I took only two rubrics here. If you go to nausea, vomiting, there is a bread aggravation. Aggravation part, then bread. And took the second alcohol amelioration. Medicine was oleander. nausea, vomiting, aggravation from bread, and amelioration part, alcohol. Medicine was oleander. Search out that.
Yes, sir.
Page number 506, last rubrics.
506, last rubric. Yes, sir. Sobrania, nitric acid, oleander, pulsatilla, and cecal core.
Okay, and then you go the amelioration.
Yeah, alcoholic drink, amelioration. Single medicine, oleander.
Oh, there was only oleander.
Yes, oleander.
There is only oleander.
Yes, sir.
And if you go in the Materia Medica of Clark, in the stomach part,
Yes, sir.
and you will find lot of saliva, nausea, and amelioration from brandy. Appetite, if you read the last symptoms in the appetite,
Yes, sir. Empty goneness after eating and amelioration by brandy.
and you will uh, saliva and lot of nausea,
Yes, sir.
vomiting, stomach. There are some, all the things are there. So I prescribe the oleander. After that, he quit the alcohol within 2 months and eating the chapati easily. And what is the problem? Problem was the gluten allergy.
Okay.
That is the gluten allergy.
So
And
whenever he
what
eats the rotis and he get aggravated and he's ameliorated by brandy.
and one more case I solved over this rubrics aggravation from bread. It was the blood cancer case.
Okay.
And one thing very peculiar when and that is a female case. Whenever she took the bread or chapati, always vomiting, and she can eat only rice. Other symptom was there, but peculiar was this, and I prescribed nitric acid. If you go through the in this nitric is there also there.
Yes, sir. Nitric acid.
Bravnia
Yes.
and then Tuclear marbanum, then nitric acid, oleander, pulsatilla, sickle core. They are
Yes. Yes,
the
sir.
medicines. So if you are searching the peculiar, not I have seen so many doctors taking the whole case and make the symptoms and again make the rubrics and put in the repertorization. No use. If you are taking the case, your mission is search out the peculiar, strange characteristics, find out the symptoms. Not collect the whole symptom at 100, 200, 400 symptoms. No. only searching, you must search the characteristics, peculiar strange symptoms. And this is what are in this case. There was a gluten allergy. We don't know what's the disease name, but solve the case only strange thing. Chapati, aggravation, rice, amelioration. Then if you are thinking, never we can think about in this case that oleander can be the remedy of this case.
Who never, because nobody think about that. Most of the people prescribe sulfuric acid or syphilinum, or as you mentioned, you prescribe first time
What I did,
syphilinum.
what I did, I prescribed
Yeah,
syphilis first
yeah.
time, second, Naxomica,
Both are the common
according
remedies
to
for these
material
things.
medicine. Common remedy, because we have the very open shut case. This is the habitual alcoholics that syphilis
Yeah,
Materia medica is crying from this symptom. Only medicine syphilis. I was very confident. This is the open and shut case. Give the syphilis.
yeah,
And then I was very confident about the Naxomic. In this case, I never thought the acid salts and then nitric acid. No, no, need not are in mind. But when whenever you are taking the case, whenever you thinking this is very strange, always consider to first because we are searching that strange things. And that what the case of the mason contactor. What is that? Anybody breathlessness over when he is standing walking over the stairs always,
yeah. This is very
but he is
peculiar.
saying very peculiar.
Very peculiar.
So
Because
we
this
are
is common thing. If we have a heart problem and we are
total.
going,
So, so we are if we are taking the case for searching that particular peculiar characteristics, not for collecting the whole data. The problem is nowadays so many students come to me to ask how to repertorize. Then in their mind collect the whole data, put in the computer or computer repertorized sheet, so we can easily search out the medicine. And always told that these students know if you are taking the whole history of the patient to search out the peculiar characteristics, strange symptoms. So this is one case very and and the last case I'm discussing case was the urine difficulty and case was slightly enlargement of prostate. He says whenever I go urine in the sitting position, I cannot pass the urine. When I stand, I can pass easily. So according to material medica, I prescribe the casting. But no effect. I was surprised. Then I go to repertory of the BBCR. There was the amelioration from standing. Medicine was sarsaparilla.
okay,
And one thing very important in this case, patient was very poor. He carrying a ultrasound, very old. In that, he diagnose a enlargement of prostate with a cyst over the prostate. And he feels slightly easiness in passing out the urine after Sarsa Parila. And I advise go again under the ultrasound. In that ultrasound, radiologist diagnose slightly enlargement of prostate with vesicle stone. The problem from the stone, not from the prostate.
Yes, sir.
But Sarsaparilla told us, and I prescribe again the Sarsaparilla, pass out that stone, and he feels totally symptoms free. So that is the, if your medicine is right, diagnosis, what is the diagnosis? No problem. Medicine will work and cure the case. But always think about peculiar, strange, and characteristic symptoms. Symptoms means grand symptoms, full. And then, in according to representation of the BBCR or according to Hahnemann, FO number 133. Modality is a very reliable source of information. You can rely easily. Sensation, you can miss or misunderstand. But location and ambulation, you never be mislead.
Yes, sir.
If a problem in the hand, then it is the hand.
Yes, sir.
If ambulation from heat and cold, that is the fix. If patient is saying some darting, gnawing, burning, it's very confusable. So location and modality must be preferred. Location first and then modality.
Yes, sir.
Uh, what is the important in repertorization? If you are using BBCR or BPTP, then your and you must be emphasized over the modality. I always rely over the modality, never the sensation and other rubrics. I never rely on that. So it is all about my case discussion.
So,
If you have any question, then you ask me.
so this is hope so everyone understand who read organ of medicine. If you really know about how to use organ of medicine in practical life, this is a pure examples because reading very peculiar strange thing is different thing, but apply these things on your practice, especially aphorism number 153, where Dr. Hahnemann says this is a very peculiar, strange, characteristic symptoms. Boenninghausen says this is concomitants. This is the same thing. And one Perry Smith says if you have a funny symptoms mean which is very strange, and you feel this has happened to me. If these are funny symptoms are there, you should rely on it because they are very peculiar, very peculiar.
Strange.
As Dr. Sir says, if one person is walking on the level, he has biggest problem, and when he walking above in stairs, he has no problem. This is very strange because this is exactly opposite what the other person having this condition. But if the person says whenever I'm moving up I have a problem, and when I'm moving on the level I have no problem, this is common thing. That's why pathological symptoms, because all these cases, you will not see any pathological symptom. All are very peculiar. All are very strange. All are opposite non-pathological symptoms. So I don't think so. Somebody ask any questions, because this is the biggest problem in our society, that so many people, so many hypothetical books are there, so many writing down pages and pages, and the newcomers, especially the newcomers, are totally confused because they are focusing on just these books. Nobody want to read Hahnemann. Nobody wants to read Herring. Nobody wants to read Allen, Boger, or any these books. So I translate few of these books, like Organ of Medicine and Lesser Writing of Hahnemann, Lesser Writing of Boenninghausen, and I feel that we definitely miss so many things from last 10, 12 years, because we don't know what is written in, and the maximum times language is the barrier, because
Yeah.
many people only leave this book because they didn't understand, that's why they like easy writing. That's why the people are moving towards the easy writings. So thank you so much, sir. You give us
You
very,
are
very
welcome.
different concept. Actually, this is the right way. And if somebody visit Kolkata method, they always using this method. And if you like to give some advice to our newcomers, sir, please.
My advice is rely over only the source book. Source book being Dr. Hahnemann writing, Boenninghausen writing, Herring, Allen, Boger, and Clark. These are the source books. Don't go otherwise. One question asked me a student, and it was a very strange experience to me. Sir, I asked that renowned teacher how to understand a repertory. That learned teacher told me, read first five books, these books, then you can understand the repertory. What is the easy to the student, to read the five books or left the repertory?
He will
It is
left the
easy to
record.
left the repertory. Why is reading the five books? So, in a modern time, teachers also flaring are very false information in the homeopathy fraternity. So students are also confusing.
Yes, sir.
They are teachers are not stressing over the source book.
Yes, sir.
They also going to those are not source book.
Yes, sir.
So misinformation is very very on high. Like, you are translating these books. How many student or doctors read in this? One thing, if you go the chronic disease, page number 128, where Hahnemann advised, if your medicine remedy is right, is not effective, go the lower
Yes,
potency.
sir. Yes, sir.
Very clearly,
Yes.
how many doctors are reading that and using in practice? No, because they didn't read this. So I advise to every doctor, practitioner, and all, especially student, rely over only source books. Only source. If you are any confusion in the principle of homeopathy, read organ. If you want to practical application of organ, read the chronic disease. If you want to clear repertory, read the Boenninghausen, then BBCR, Boger Boenninghausen. If you want to read the Metria Medica, Materia Medica Pura, then Guiding Symptoms, then Clark.
Yes, sir.
I guaranteed after these books, you haven't any confusion about the homeopathy. So, good night,
Thank you, sir. Thank you
Dr.
so much,
Devendra.
sir. And we learn a
Thank you.
lot.
Welcome.
Also, we will meet you very soon. And definitely, if you guys,
Okay.
even after this session, if you guys have any question, please let me know. We will ask sir all these questions, and we will definitely clear
Always
all the
welcome.
doubts.
Always
All the
welcome.
doubts. Thank you so much.
Always welcome.
Have a good night, sir. Thank you. Thank you so much.